Hello, people. Thank you once again for listening to our podcast, The Kids I'll Talk. And today we are going to talk a little bit about medical schooling here with our friend Isis. How you doing today, Isis?
What's up?
I'm doing good. I'm doing good. Thank you so much for having me on the show.
Hell yeah. You're straight up in H-Town right now, huh?
Yeah, I'm in the medical district, so I left. So I did medical school there in El Paso.
Mm-hmm.
So I was there for 4 years, and then I did residency, finished residency 3 years in Miami, and now I'm finishing the last etapa of my medical training. I'm doing a fellowship here at Baylor in rheumatology. So
Oh,
almost
shit.
done.
Wait, what's rheumatology?
Rheumatology is like you probably get to meet a lot of patients with rheumatological issues. Like they're patients who get lupus or rheumatoid arthritis or just weird diagnosis. So lupus is one of the more common ones that we treat. So all the lupus patients, the young girls that get lupus, we see them.
It's only women that get lupus, huh?
Men can get lupus too, but it usually does, like a lot of autoimmune disease, it affects women, and lupus really affects women of color. So Latinas, Black women. Even when I went to interview in New Mexico, they were saying that the young Native women there, they would get really severe lupus. So
Damn.
it's
What
very
is it?
common.
Is it like diet?
No, I mean, we don't really understand autoimmunity very well. Like for rheumatoid arthritis, we know that smoking is a risk factor. But like in terms of lupus, we don't really understand what offsets it. I personally think this, and this is a very non-doctor way of thinking and saying, but I really think that a lot of times, like uncontrolled stress and anxiety, like I don't know if that has a big part in offsetting your immune system and making it more active, and then attacking your body. So, but that's one of my theories.
And dude, with lupus, I've met a couple of women that had lupus, and they're usually really young and really small. Does that have to do with their size?
Uh-huh. No, I mean, not that anything that we know of, no.
Nah. I thought it was because other girls that I met that have lupus like are real tiny and shit. So I was like,
Well,
oh,
the thing is, by the time you might have met them, if it's uncontrolled, a lot of times, like if you see people that have really uncontrolled, like their immune system's going off, that raises the inflammation. So like cancer, a lot of the cancer patients, they'll look very, very skinny, and same thing, a lot of people with autoimmune diseases, their nutrition is down and their body's in constant inflammation. So sometimes they don't want to eat, or just like the constant inflammation itself leads for them to lose weight. So you might have met them after, they already went through their rough patch, and that's what you got to see.
yeah, and I would see them, and then they would get like red and swollen in their faces. It was bad, dude. It was like, oh shit, dude. But
Yeah.
anyways, Isis, we want to go ahead and know a little bit about you. You are from Honduras, aren't you?
Yeah. So my family's from Honduras. My mom and my dad, and when I was 2, I was born in Florida, and I went to live in Honduras for 8 years.
Oh shit! So you were born in Florida and then you moved to Honduras.
Exactly. Yeah.
Oh shit!
So I lived in Honduras for like 8 years.
Oh shit! And when? How old were you when you came back?
I was like 8, almost 9. I came back to Florida. Yeah.
It's a big ass change, no?
It was because Honduras got the reputation of like crime, and I definitely got to see that, and a lot of poverty, a lot of people that are very sick, bad healthcare. So I got to see all of that. I think that's probably where I became interested in going into medicine, because my aunt, she didn't have any like formal training, but she would take care of like everybody that was sick. She would like go and like give them injections and like give them fluids, give them, you know, if they died, she would go and like, you know, talk to the family and even get them ready, like do their makeup, get them ready for their funeral. So she was just very much like at 3 a.m. if there was an emergency, she'd wake me up and she'd be like, let's go take care of the sick person. And I think that was, I go with her, yeah, as a little girl. So that was like, she was really like, who introduced me into this, you know, taking care of sick people and being that for the family member. So that's where my interest started because of her.
So, yeah, your interest started like that, but when or how did it start becoming a reality? When or how or at what age did you start like telling yourself, yeah, I could fucking do this shit, dude. I could fucking become a doctor.
Yeah. So my mom, she's a single mom. So, it was me and 2 other kids. And really, I remember like in middle school, like I used to skip a lot of school. Like,
oh shit.
I used to skip so much school.
Right.
Like to a point, it was bad. It was so bad. Like we would get like truancy letters, and we would get them. My mom would never know.
Oh,
like
shit.
we would call in the school and we would act like we were like I was my mom's voice. Like, yeah, this person can't come into school. So we were just bad kids. And I remember they came to talk to us one time about like saving money up for college. And I was listening to like Kanye West Through the Wire. And I remember like I was just this is like 2004. And I remember thinking like, what the like college? Are you kidding me? Like that was not a reality. I never ever thought about going to college at that time. I was like, how am I gonna get money? Like, you know, like no one in my family went to college. Like I didn't know about the SAT until like a month before I took the SAT.
Oh, shit.
So really it wasn't a reality until I went to a high school in Florida, and the teachers there were just awesome. Like they were, I don't know, they just saw something in me, and they were like I went from having like teachers not really paying any like attention to me to like high school. I went to like this really bad school, but the teachers were awesome, and they really motivated me, and they were like, they would tell me like all kinds of things. So that really motivated me into going into medicine. And they were talking about the whole Doctors Without Borders thing. And when I heard that, I was like, oh my gosh, that sounds amazing. I want to do that. I want to be, you know, I want to do the whole Doctors Without Borders thing. And then I just started changing all my whole schedule around so it was like 9th grade when I was like, all right, I'm going to do this. And then I just, you know, just next step.
And why that rheumatology? Whatever you said. Sorry, I'm from fucking Quad way.
Oh, why rheumatology?
Yeah, rheumatology. There you go.
Well, yeah, same. In high school, I had another teacher who she had a class on the immune system, and I loved the immune system, and I was like, oh my gosh, this is awesome! Like how your body protects you against viruses, bacteria. So, and then in college, I took some real nerdy like immune system classes, and I was like, oh my gosh, I love this. Then I did research at UT Southwestern. I wanted to get into a lupus lab, but instead I worked in a multiple sclerosis lab, which is when your own body attacks your brain and people have trouble, seeing, walking, all of that. So I did research in multiple sclerosis, and I remember telling my friends, I'm like, I want to be like a doctor who treats autoimmune diseases. Like I just love the immune system. And my college roommates, they were like, oh, so you want to do rheumatology? And I was like, what's that? So I started researching it more, and the more I found out that like it affected women, because I really loved OB. But I didn't like the surgical aspect of it.
Right.
But I liked how it was mostly women as patients. So I really liked that it's like women and, being a woman of color, being able to treat young women my age with these illnesses. Like everything just kind of matched for me. And it's super interesting. Like I love everything in medicine. Like I love internal medicine. And with rheumatology, since, your immune system can affect your brain, your eyes,
Mm-hmm.
your lungs, every single organ can be affected.
Mm-hmm.
So it's very systemic. You don't have to forget your training in pulmonary because it's like you're a generalist specialist. So I just think it's the most interesting field, and that's why I picked it. Yeah.
Oh shit, that's fucking dope, dude. Now, also, I wanted to go ahead and fucking ask, dude. Sorry about my bad words. Sorry, I just fucking had a long day. But, oh shit, what was I gonna ask? I hate when don't you hate it when that happens? Where you fucking blank out? Gotta stop something.
What you gonna ask me about COVID?
Nah, not about COVID. I was gonna ask you something about the medical field. But, anyways, take it over, Esteban. I need to remember what I was going to ask.
Aye. So, yeah, I see. So, well, what do you know about, do you know anything about COVID? Does that have anything to do with like autoimmune diseases or not at all?
Yeah, actually. So that's why initially when the whole COVID pandemic started, rheumatologists were kind of very much involved in this because even the medications that we're using now, we're trying a lot of medications that usually rheumatologists prescribe. So like Plaquenil, that's the hydroxychloroquine that they keep talking about on the news. Mm-hmm. Initially they were saying, okay, this is good for, treating it. And there's other really, expensive medications that they're using and they're, testing out. But that's the thing with COVID. That's why some people have symptoms and other people have no symptoms, because a lot of it is, we're thinking at this point, a lot of it is, genetic, environmental factors. But really the reason why some people die from COVID is because their immune system goes crazy. Like there's the virus just activates something similar to like macrophage activating syndrome, and it's when your immune system just kind of goes on overdrive, and it's that inflammation reaction that leads to all the fluid build up in the lungs, and that's why people can't breathe. And even when they're on the machine, they keep going up on the oxygen for the ventilators, but it's still not enough because their lungs are just overwhelmed with fluid and are destroyed. So a lot of that is not even like, yes, we know that like if you're older, if you have diabetes, hypertension, heart disease, those patients are the ones that are at higher risk of getting complications. But we still see very young people like just have nothing wrong, no past medical history. And, that's why we're treating it with this medication, is because the immune system goes into crazy activation, and that's what leads to a lot of people dying. Yeah. I'm sorry. And I mean, this virus too can get you clots. So people very young are presenting with strokes. It can lead to myocarditis, which is when we're thinking at this point that the virus itself goes and attacks the heart, like the muscle of the heart.
Mm-hmm. And sorry, go ahead.
So a lot of ICU doctors are, seeing, these heart abnormalities with conduction, and that they're dying of a lot of things. It's overall the risk of death is low in most people. Most people, they get like a little, upper respiratory infection, and other people, they can die from this crazy activation
but isn't just
the virus.
Isn't that just like the regular flu though? I mean, I've heard people dying of regular flu all the time.
Yeah, people die of the regular flu for sure. But those people are usually, and I mean, the flu can really, kill anyone too. But this this virus is more complicated than the flu, like the side effects. And the flu usually goes with like, somebody who already has like COPD, like really bad lung disease, and then you add something on top of it and it just tips them over and they pass away from it. So it's more dangerous than the flu.
And dude, I wanted to also ask you, I watched, I don't know, I listened somewhere where they were saying that people that were put on ventilators usually were the ones that were dying the most, because they said that when with the ventilators that your fucking lungs were like saying, oh, I guess I don't need to work because something's working for me, and that they shut down, and that these people were like the ones placed on ventilators were dying the most. Do you know anything about that, or is that bullshit or what?
Yeah, no. I think initially there was every time that the patients, their oxygen levels were dropping. We would place them on a ventilator, but they didn't have very good outcomes. So now what a lot of the ICU doctors are practicing, they're trying to just stay with the oxygen, or like high flow oxygen, or other non-invasive machines that they can try. Some of them are saying that they were getting like trauma. Like, so sometimes to use the ventilator, it uses pressure to like put oxygen into your lungs. And some doctors have discussed like barotrauma, that the actual ventilator was giving more trauma to the lungs and causing more lung damage with that.
So it wasn't even like the COVID that like got them. It was just the machines that kind of put too much pressure on their lungs.
Exactly. So that's what they were saying. They were saying that it was more of like the barotrauma, and that's what they were saying.
Also, I remember I heard once that they were using that steroid, what's it called, dexamethasone or something like that. That it's that would help strengthen up the lungs, and that would help a lot with COVID patients. Do you know anything about that?
So that usually we use steroids. So the practice that we're kind of going with now is earlier on. This and this is the logic that we're using is. Earlier on, you need your immune system. So steroids, what they do is they decrease inflammation by suppressing your immune system. So all of the immune system that causes increased inflammation lead to fluid buildup, so edema, and that can worsen the lung function. But what we're trying to do now is, initially when you get like the virus, we're recommending not to use steroids because we want the immune system to fight off the infection itself. We don't want to suppress it and the infection go uncontrolled. But now, so that, and then we're also recommending to use steroids once the immune system has just gone haywire and we want to decrease it. So that's why we're using it in these patients that end up in the hospital, in the ICUs, because by that point, their immune system has gone into haywire, and the inflammation just goes up so much that not even these fancy medications, not even the cheap steroid medications that we give, and then the super expensive medications can revert that, can control the immune system. So we're recommending steroids for that, to decrease inflammation and suppress the immune system.
Damn, well, I'm just waiting for all this to stop. I'm ready to go back to a normal life and to be able to travel without being scared. And it sucks. So anyways, Isis, let's go ahead and move on from that. I also wanted to go ahead and ask you about the process of, being accepted into a medical school. Like what would one have to do to to start, like if they wanted to be a doctor, what would they have to start doing in high school to facilitate that transition and that whole career, you know?
Yeah. So I would say, yeah, high school is a good time to start. People can definitely change their minds in college too, but yeah, the earlier the better. And I would say, you know, especially for kids, you know, that come from a low income background,
Mm-hmm.
it is it's a lot harder for us to get into this field because so many things are so expensive. But I would recommend in high school, just try to be a good student. Take AP classes, or if you want to stay in Texas, really the smart thing is to take dual degree
Mm-hmm.
courses, because I took a lot of AP classes and a lot of those won't really transfer. So it was like art or world history or random stuff.
Mm-hmm.
So really taking dual credit is better because you can get those transferred to a university, and then you can graduate maybe even earlier than maybe like a semester or something earlier. So even though you have to pay for it upfront, I think dual degree classes would be better. If I could go back in time, I would have done that. And then make sure you take your SAT, apply to a lot of scholarships. I applied to so many scholarships,
Mm-hmm.
and you know, especially if you come from like a low income background, there's so many programs that, you know, as long as you have the grades and, you know, you show them that you have the determination,
Mm-hmm.
they will help you out. So, you know, I was able to get my college paid for, and a lot of universities themselves too, they have scholarships that they will offer, you know, if you apply to them or if you qualify, whatever. So after high school and you go to college, college is 4 years, and a lot of people do pre-med. So you can do any major that you want. I did molecular biology, but if I could have gone back in time, I would have done maybe history with
Mm-hmm.
pre-med. That just means you have to make sure you take all of the courses that makes up a pre-med. So most people, it's easier. They just do like a biology or chemistry degree.
Mm-hmm.
You know, because that all of those degrees have like the classes that you need. So it's usually 2 semesters of biology, 2 semesters of chemistry, 2 semesters of calculus, 2 semesters of physics, 2 semesters of organic chemistry, just different things like that, and labs.
Mm-hmm.
So once you have all of that, then you take your MCAT. Once you take your MCAT, which, you know, it's expensive, and I took it twice because the first time I did not do good on it. There was a reading comprehension part, and I did so bad. So I think now at this stage, I know how to practice for these big exams. But when you don't know how to, you know, study for these big exams, it's overwhelming, and you do need to give yourself a lot of time to study, and that's something that I didn't know. I did so bad on the first time, so I had to take it the second time. And in Texas, there's actually a program called JAMP, Joint Admissions Medical Program, I believe. And I applied to it. You have to be low income. And what it is, it's a program that they'll give you like a few, like $1,000, $2,000 extra per semester.
Mm-hmm.
They pay for your training for MCAT actually. And they help you with, you know, travel expenses and interviewing, and you get to interview at all the medical schools in Texas. So you apply to it. If they accept you, then they help you out so much. And I just wish every single state had something like this, because I just keep thinking back and I'm like, that was so useful, that like extra money and that extra, you know, level of training, because when you come from a family that, you know, no one has gone to medical school or even graduated college, like you have no guidance. And that's something that I realized a lot. Like when I lived with my college roommates, like they would have guidance on like how to do a checkbook and how to save for this and how to, they were saving for like their retirement because their dad had a retirement fund. Like so many things that like parents who were educated and teach their kids and like look out for them or give them, that extra summer SAT training that they paid for. Like a lot of times, like in our families and Latinos, we don't have that. We have to figure things out on our own. And, like I'm grateful for programs like that because it opens up the door for us to know what to do and not be so lost. So, so after the MCAT, then I went and I applied. I ranked the schools that I want, and the system is always matched. So for medical school, you match. Everything is matching. Where you rank, and then the schools rank you, or the programs rank you, and then you match. It's like eHarmony.
Yeah.
And then after you match, then you go to medical school. You do 4 years, and then the first 2 years is just schoolwork, studying, exams. And the last 2 years of medical school, so your third and fourth year, you get to go to the hospital, and you rotate through psychiatry, internal medicine, family medicine, surgery, OB-GYN, emergency medicine. So you rotate through different electives to whatever you want, and then that's when you kind of get to decide. Like you get to see like what you want to do, what you want to apply to, and then people then apply, and then they apply to residency, and then they match using the same eHarmony ranking thing, and then you go on to your residency, and then after residency, residency is you're still studying, but it's more work. So you're working more, and you have a lot of responsibility in residency. Like a lot of responsibility is on your shoulders. So residency is very, very tough.
And what department would you do residency in? Was like emergency room or what?
I ended up doing internal medicine. So internal medicine is like, oh yeah, and you rotate through pediatrics as well. Internal medicine is like taking care of adults. So every specialist, like cardiologist, every single specialist, nephrologist is an internal medicine doctor. To become a specialist, you have to train in this huge branch of knowledge, which is internal medicine. And that's just like we take care of, sick adult patients in the ICU. We go down to the emergency room, we admit them, cancer patients. So we just take care of all the adult patients. And then if you want to specialize in any field, then that's when you apply to fellowship. So undergrad, 4 years, medical school is 4 years, residency is usually 3 to 4 years, and then you apply to a fellowship, and a fellowship is 2 to 3 years. And then you're done. After you're done, you're an attending. Then that means you're just completely done with all your training.
So you're not even a doctor yet at that point, or like a profession? You can't.
No. Once you graduate from medical school, you're a doctor. So you get called a doctor. You can prescribe medications. You're an MD or DO. And once you do that, but you're just a training doctor, which means like I could have been done with my training if I decided to stay generalist. So I would have been like a full-fledged doctor now. But when you decide to train longer, then you do a fellowship. So you're still a doctor, but it means you're practicing under the supervision of other doctors who are completely done with their training in that field.
And even after like that 3 years is done, are you still technically like under a guidance of a mentor or something?
Yes, because if I would have done generalist, I wouldn't be under anybody's training. But because I decided to specialize, and I'm in a 2-year fellowship program right now, I'm training under the supervision of doctors who are already done training for rheumatology. No, and for sure, I would feel so scared if I wasn't under, like I would feel so scared because after I did residency for 3 years, I felt really good managing, general internal medicine sick patients. Even in ICU, because we get a lot of ICU training. So I felt more comfortable. And then coming into this fellowship, it's like all of these drugs that I never prescribed because they were hardcore drugs. You know, you can't just give, you know, you have to be very trained to give these medications. So I feel like I'm back to square one, like so much to study, so much to learn. I feel so scared if I was just doing this without any training.
Hell yeah, that shit's scary, man. Being all responsible for the health of other humans. That's a big responsibility, right? Yeah. Shit, dude. Now, when you're done with all that, you're able to practice. You could be on your own now. What next? Do you join a firm of doctors, or are you gonna open up your own little office, or how does that work?
I don't know. Yeah, I don't know. I'm actually thinking about going back to El Paso.
Mm-hmm. Well,
so,
I think it'll be nicer. I mean, have fucking, you know, Hispanic people to take care of. You know, not so much racism and stuff, but like I do notice that a lot of Latino doctors do stay here or come here. You know what I mean? Like
yeah, that's true.
Yeah, I met a lot of like Cuban nephrologists, and actually I have a nephrologist that's Hondureño también. So
really,
yeah, Dr. Fernandez, I think is called. But yeah, he's it would be cool to have you here in El Paso, you and John.
Yeah, that'd be awesome. Yeah, I mean, I don't know if I would do my practice versus join. I think that more doctors should move into private practice. That's what I've been feeling lately. And by lately, well, I've always liked academic medicine, so I always thought I would stay in academic medicine. Academic doctors, they get paid less than private, but you get to see like the cool, really interesting patients. You get to teach the medical students, the residents. So I always imagined my life staying in academic medicine. So like doing, you know, either staying here in Baylor or like going and you know, to Texas Tech, like staying somewhere associated to a teaching hospital. But I don't know. I feel like medicine has changed so much in the last decade that I think we're losing a bit of power as doctors. I feel like we're not business savvy people. So I feel like a lot of the businesses have kind of, they're exploiting everyone. And we're some of the people that I feel are being exploited. And I feel like by starting our own businesses and practices, we would have more power over how we want to run our practice.
What do you mean that you guys are being exploited? How are the doctors being exploited now?
Like, especially with this whole COVID thing, a lot of hospitals are not doing as well as they used to. Patients aren't going to the hospitals. I mean, people think that because we're doctors that we're not experiencing some of the side effects from this pandemic, but we are, because a lot of places are getting cut and they are you know, like not hiring as many doctors, or they're picking certain options that save them money. So because it's their business.
Mm-hmm.
You know, so I think everyone is. I mean, that's a whole other podcast episode. But yeah, things are changing quickly, and I think that I would still prefer to be in an academic hospital just because of that environment. But I think that more doctors should start opening up their own practices, because they always tell us, oh, it's so hard to have your own practice. It's so hard. And it is. It really is. But I feel like the government has put a lot of things to make it hard, because instead of us having our own practice, if it's a business running the practice, then they get to, you know, capitalize on a lot of things, which does make it easier for us. We don't have to be worried about billing and this and that. But I don't know. I feel like more doctors should have their own practice. I
Yeah.
think we need to be more business savvy.
Yeah, I was going to ask you about that. I was like, well, if you own your own business, I mean, wouldn't that take your attention away from your patients to focus also on the business aspect of it?
That is true. And I know that it can be very stressful to a lot of doctors, like, because a lot of times the insurance won't pay them, and it's a lot. But I mean, if your business is running smooth and you have somebody that's helping you, then I guess it can be easier. Another thing is, what I think would probably be the best practice is for multiple doctors to join together and manage a business together and help each other out. And especially if they're of the same, if they're of the same specialty, yeah, they can take turns in being on call. That way, the weekend you're on. There's different ways, but it is a tough field, and I think things are changing that are not favorable for us.
Damn, this is crazy, dude.
Yeah.
I know you had said that you applied for a lot of scholarships and all that, but for someone that's trying to, do the whole medical field, what is the whole financial, like
is the payoff good?
Yeah. I mean, is it worth it? I mean, I'm sure you have to spend a lot of money when you're studying.
Yeah, it's a lot of money. Like, I actually took a test on Friday. So my American Board of Internal Medicine test, that was $1,200.
Damn.
So, and you have to take multiple exams when you're in medical school, like board exams. So you have to take step 1, step 2, step 3, and then step 2, CK. Each one's like $1,000. Yeah. So in total for tests, including MCAT, all of that, I paid over $5,000 in tests. But it is really expensive. And I think to somebody who's thinking about, money and wants to make money fast, and maybe it's not for their own self reasons. Maybe they got family to take care of. Maybe their own family is sick, and and they need to get paid fast. I would not recommend going into medicine. But if they want to still take care of patients, and they like that medical aspect, they can look into physician's assistant, which is, you do 4 years and then you do 2 years and then you're done. You're done. You can go and train. So you can really be done with all your training in 6 years versus, 11, 13, 14 years of training the doctor route. So you get to cut your time in half. Same if you go to become a nurse practitioner. So you can still practice medicine and start getting paid. Like, if I would have taken that route, I would have been making money by the time I was 25. Instead, I'm going to be 32 by the time I'm done with everything. And so it's like a huge delay of when you actually get to see the money. So I think if you're trying to get paid, don't go this route.
Right. And personal question, are you deep in debt because of your career?
Am I what?
Are you really deep in debt?
I am in debt. But it's not, I don't even think about it. I don't care. Well, for one, I got lucky because I also, I got a scholarship for medical school too. So I had a lot of, I got really lucky and blessed in that regard, but I'm still in too much debt for having my college and my medical school paid off. I'm like, I mean, I did pay for my own master's, so my master's was like $20,000, and I paid out of pocket for that. So that's really where some of my debt is from. But you're in debt. But I mean, I think after a while, people in medical school, we don't even talk about our debt because we we just don't even like to think about it.
Right. Yeah, because you know those big bucks are coming for. You're like, ain't nothing.
Just eye on the future.
I mean, it is kind of true. You're like, yeah, in a few years when I get paid, that's my plan. Like, I'm probably going to stay living in the same place I'm at, and like, I'll just keep living the same. And then, once your paycheck goes up and you just knock out your student loans, and that's what a lot of people do.
Right.
Yeah. And then I had a question, like, say you go to the route of becoming a nurse practitioner or something like that. Could you become a doctor after that, or is it the option closed?
The option is closed. So to become a doctor, you have to, like, MBBO, like, you have to do the route, which is medical school. You have to go through medical school training, like a program that will certify, give you those initials to your name.
Okay. Those medical schools wouldn't accept a nurse practitioner or anything like that?
No, because nurse practitioner school is different. The nurse practitioner could become a doctor but they would have to, after they finish with their nurse practitioner training, they will have to apply to medical school and then would have to apply to residency. So you have to do the whole. So really, if you are thinking, and there are some nurse practitioners, like I read online, that a lot of them wish they would have just done the doctor training all the way. That if they could go back in time, they would have done that. Yeah. So I think if it's something like in people's mind, like where they're like, oh well, just do the whole doctor route, because doing the NP route and then going back and saying you want to apply to medical school and then doing residency, like that's gonna take so much longer.
Yeah.
Damn.
That's gonna take a long time. So I would just decide and have really good insight and talk to a lot of people to decide, what you want to go into. I have a friend, she decided to do PA, so physician's assistant, and she had to really think, like, what is it that I want? Her grades weren't, she struggled. She had some family issues in college, so she had to really think, like, where, what do I want to do? And also, like, as a woman, you have to think, when do I want children? And I really don't know that many women with children that did this whole doctor training thing. Mm-hmm. It would have been so hard for me to have children and have done it. It's doable. I mean, humans we can do whatever we want, for sure. Mm. It's just so much harder. It's so much harder. So you have to think, if you want to start having kids at a certain age, you really, really have to think about what you want. But also as an NPs, you have to think, it's hard because they don't get that training. They don't get a lot of the training, we get. Those years of extra training give you that confidence to treat and diagnose a lot of cases, mm-hmm. And that's one thing that, we sometimes do a disservice to NPs, that the training is not enough to make them feel like they can be completely on their own.
Right. Damn, that's crazy.
I'm sure there's some that feel comfortable. It's just,
mm-hmm. Yeah. Now, also, I wanted to go ahead and ask you, the medical field, I'm sure, is very dominated by white people. So have you felt racism, any type of prejudice, any type of discrimination in your medical career?
Yeah, from everybody. Patients mostly, honestly.
Oh shit!
Patients are the ones that give me the most discrimination. So I did my training. Yeah, I don't know if it's because I'm a woman or, minority, or a combination of both, but there'll be many times you introduce yourself as a doctor and they're like, no, I want to talk to a real doctor. And it's like, okay, like, and then you're with a student, you're like a third-year resident, and your white medical student gets more respect than you, and you're just like, what? So things like that from the patients, and from medical school. I was lucky enough to not really get, only when I did my surgery. I did my surgical rotation, and me and my white medical student, we were both medical students, so we did the same rotation. And there was times where we'd be like, yeah, let's go get breakfast, and we'd go get breakfast, and then we'd be late to like the clinic, and they gave me like such bad feedback, and they gave him great feedback. And he felt so bad. Like, he felt so bad for me. And it was like, this was in El Paso, and it was like, I remember we would have meetings, and it was like 30 white guys and me. Like, so I was like the only woman and the only person, of color in the room. And I'd be like, this is weird. Like, it would just make the lack of diversity would just make me feel so uncomfortable. And so, yeah, the student felt so bad because he's like, how did you get such bad feedback? Like, how did that happen if we were doing the exact same thing? Mm-hmm. So, you experience small things like that. Luckily that was erased, but if that would have stayed on my records, like just that really bad feedback, that could have affected like where I could have gone for residency. And where I went to residency was like Miami. So it was a bunch of Latino doctors, Black doctors, like super, super diverse group of doctors. And it was beautiful, like training there, because, the patient, like moving to Houston, I feel like the relationship is not the same. Like, I feel like people here, they don't trust the doctors the same. Like, there's a lot more mistrust. Whereas when I was in Miami, the patients would get mad at you if you were like running late or, but they were still very like grateful, and it was more, like you could tell that the culture there, they respect the doctors. And I feel like practicing in that environment was nice. And then I came here, and it's still great. Like, the patients are still very nice, but I think because most of the doctors here don't speak Spanish, they're not Latinos. Mm-hmm. And they're not Latinos, they're not Black, so they're mostly white and Asian. Mm-hmm. And I think because of that disconnect, there's like some form of mistrust, or like there's been miscommunication about things. And so that's something that I've been talking about with my new patients. I'm like, it wasn't like this in Miami. So I think coming here, realizing too that you're like, you're a minority, you're a doctor, and it's so important to have more of that to be able to treat our patients, because it makes a huge difference. And I had forgotten that. For 3 years, I forgot, because I was in a totally different environment. I came here and I was like, oh my gosh, like, I speak Spanish. Like, it's so important to have like doctors be representative of the community that we serve.
Right.
So,
well, Isis,
yeah, for sure.
Hey, I have a totally unrelated question, and it kind of goes back to the whole COVID thing. And well, I don't know. You hear all these like conspiracies that say it was kind of created in a lab in Wuhan. So, what's your thoughts on that? Do you think it was like biological weapon, or do you think it was just an effect of just nature and mutation?
Yeah. I would totally love like a podcast, another one where it's like we talk about the myths of COVID. So a lot of people were saying that it was engineered. I mean, so far we don't have really much evidence. We're thinking that it came. The first case, really, we have in China, so that's where we're saying that it originated. But as far as it being like a weapon, there's no evidence of that, and that it was bioengineered. They took the sequence, like they took the genetic sequence and ran it through, and there was really no evidence that it that it was done as a biological warfare. And two, I also think that if somebody were to create something like that, I feel like it should be a stronger virus, because we're talking about the mortality rate for COVID being like 3 to 4%. I think sometimes these conspiracy theories, they're not creative enough. Because really, if somebody wanted like a bioterrorism, like why not Ebola? Like why not have Ebola just? I mean, Ebola has a mortality rate of like 80%. Like just
and it's pretty gruesome.
This is yeah, and the thing is, a lot of people are like, "Oh my gosh, I can't believe they already have like a vaccine." Because there's so many different companies working on a vaccine. But everybody but Moderna is using like they're using in 2001 we had like the SARS, and we had the MERS, the Mediterranean one. So these are all coronaviruses, so they're genetically similar. And they're kind of working off of the previous vaccination. So people freak out because a pandemic is always scary. But this has happened throughout history. Like just because we have, modern medicine and Western things, it doesn't mean that these viruses, these little things that we can't even see, aren't going to come and threaten us whenever they want to. Like that's science. Mm. That's the 1919 flu. We always think we're smarter than these little tiny creatures we can't see, but they're so smart. They know how to take whatever antibiotic and become super resistant to it. They're constantly scheming, and we have to keep up with that. And it's just science and it's history.
But we've evolved, right, for like 250,000 years. And we've never had vaccines. We didn't evolve with none of that. And we still made it, in humanity. Why do you think we need these things now?
I mean, the thing is, if you look back in history, if it wasn't for scientists, we would have been having so many issues. Like, we need these things to kind of help us live longer. Like our life expectancy now is like 80-something years old. Like we get to live a lot longer. And, back then we had the bubonic plague, and then we had cholera, and we had, like the pox virus. So if it wasn't for that dude who, saw that the milkmaids weren't getting the same pox virus, and he came and made up their own vaccination for it. He was able to vaccinate a whole bunch of people. Mm-hmm. Same like before polio, it used to paralyze people. So people were affected. I think we've just gotten to a point where we become so comfortable that we forgot there was a time where these viruses affected the way that we lived. Like a lot of our family members would be, paralyzed from polio, or they would have this, or even some of these viruses, like years later, you get affected by it, and then years later you have like testicular cancer, like the mumps. The mumps virus can give you years later. Same with, we have a vaccine for these HPV viruses. Mm-hmm. So the ones that are known to really cause cervical cancer, and a lot of young women, if they don't get their pap smear done, they get cervical cancer. And so this virus can help to prevent that. So, I mean, I just feel like it's because of so many advances and all of these vaccinations that we're able to prevent so many issues, and we're able to live healthier now.
Yeah.
Also, so if we can prevent it, why not?
Mm-hmm. Also, I remember a long time ago I was reading that they're seeing that the population is less trusting of doctors. Why do you think that is?
I think the population is becoming less trustful of doctors. There's so many things that go into it. Mm-hmm. none of the things that I'm really going to say are backed by really any data. This is my own personal opinion.
Mm-hmm.
But as we were talking about, I think not being from the same cultural background, not being able to speak the same language, I feel like you should have like a population that's representative of the people that you serve.
Mm-hmm.
But I think also, I think that these insurance companies, everybody, like they're forcing us to see more people. And when you have to see so much more patients and chart and document, a lot of doctors get burned out too because we're so busy. We don't have, I think every single patient, they go in and they're not mindful that we have so much to do too. So they want to talk about so many different things, and you feel bad because you want to listen. And especially now with COVID, so many people are so lonely.
Mm-hmm.
They come see you in office and they want to talk to you like you're their best friend. They want to tell you everything. And a lot of doctors, we've seen that. A lot of people are feeling more lonely. They want to talk so much. And it's like we want to hear you out. The way that my time is set up, like I have to make sure I get these refills, and then the pharmacy calls me, and there's a lot of things that you got to do. So I think we don't have maybe we don't have as much time to like hold hands with people. And I think that whole aspect, like I've seen my favorite doctors, like even if in a short time, like when you put your hands on somebody, I think maybe we need to be a little bit more lovey-dovey and be more tactful about how we redirect people.
Mm-hmm.
And two, like, yeah, people, I think when they talk, so it's also a cultural thing. I'm sure people have had bad experiences, where, maybe the nurses are also burned out. But I think the culture too, in American culture, like it's more like anti-medicine. And, but it's weird. The thing about American culture, it's like, they're anti-medicine, yet they're not doing, things to keep themselves healthy. Mm-hmm. It's like, you can't be like so anti-medicine and then be like, oh yeah, like I've seen so many people talk about like oils and all this natural stuff that they're into, but then they're eating horrible. And I'm like, why are you like, what does it matter what you put on your skin if you're eating something terrible for your colon and you're going to get colon cancer or something from it? So it's a culture that's very
hypocritical, I guess.
It's just a very different culture. And I think our biggest issue is we need to have Medicare for all. Like we have to, I think having Medicare for everybody, I think that would do so good for the healthcare of this country. And I think that having Medicare for everybody would improve the satisfaction of doctors. That's my personal opinion.
How so?
And also,
how so would it improve the satisfaction?
Because I feel like medicine should not be privatized. I feel like medicine shouldn't be a for-profit thing. Mm-hmm. I feel like we go into it to help people out, and then I feel like so many businesses try to take advantage of, like, I don't know, we train forever to treat sick people. You get out there in the world, and then there's so many aspects that we didn't learn about billing and this and that. And so it's like, I feel like it would make it so much easier for us just to focus on the medical aspect. And I think if people had access to healthcare, then we would have healthier people where they go and they get their screening, they get their pap smear and their mammogram. I don't know. I feel like a lot of times they wait till last minute. They end up in the emergency room, and then they end up dying of something horrible because they didn't see a doctor for like 10, 20 years. Mm-hmm. So I don't know. I just feel like having access to care, that's like, it would be so great because it would help, it would help the relationships that doctors are having with patients. Maybe that would help to increase like the trust from the patients. Mm-hmm. And I think that it would be good for us to, like, even if whatever we get a pay cut, it would just be good for us to just not. We went into medicine for the medical aspect, like keep the business stuff out of medicine.
Mm-hmm.
Yeah, definitely. Because I think a lot of people, when they go to the hospital, they feel like they go in for one thing and they come out with like a couple of different issues, or they'll be prescribed something that'll heal one thing, but then it'll cause a bunch of other different issues.
Yeah, like different side effects from medication. Yeah, and that's the thing. Like every single patient needs to have access to a doctor that they trust, that they get established with. Because too, I think it's just so complex. Again, this can be another podcast episode because I think people too, like they don't understand how medicine works. And I think sometimes people, instead of communicating certain things with their doctor, they, like I've heard so many times, it's like, oh yeah, this doctor, he kept ordering a bunch of lab tests. And I was just like I need a diagnosis now. And instead I just want to go to the hospital, but then they didn't want to take me into the hospital. So I think a lot of times the general population, they don't understand how the hospital works. Mm-hmm. Like if you don't have a reason to be hospitalized, they will not hospitalize you, even if you're sick, a lot of this can be solved in a clinic or you can follow up in a clinic. So it's just hard because they don't have access to care. So then they're going in, and that's not a place where you don't need to be going to the hospital. You need to be going to the clinic, but you don't have access to the clinic. So it is very much my personal opinion and many others, the having access to healthcare, having Medicare for all would really be beneficial. But anyways, what I was saying is, so a lot of people are like, yeah, I don't have time for that doctor who's ordering, but that's how we're trained. We're like, okay, could it be this? And then we order this. And if it's not that, then it's like, well, we start ordering weirder things to finally get to a diagnosis. So diagnosing takes a lot, because if we order, if you come in for fatigue, if you're tired, you know how many things can cause fatigue? So many different things. Or if you have, just different vague symptoms, so many things can cause that. So it's like, we can't just order all of the 1,000 tests for it to be able to give you that diagnosis the next day. We have, it would be so expensive. It would be rude to the patient if we just order a million things instead of how we're trained. Oh, the more common things, it could be this. And the patient also tells you that it has that, so it's probably this. And you order, it's the way that we are trained to think logically, but also to try to save money and not order, a CT scan and just go, crazy ordering everything. And so I think a lot of people don't understand that, and that it's important to follow up with your doctor and make sure you're getting the test work, and that sometimes diagnosing something takes a while, and people have to be patient. Going straight to the hospital is it's not the answer for a lot of things.
Yeah. That's true, right? But I also see like a bunch of commercials about right, like if you and a loved one died with heparin, please call us or whatnot. You don't think that these companies making these medicines are just in a hurry to put out the product, that the trials that they do are not really that long? Like a year, 2 years, to me is nothing, dude. I think when a medicine has to come out, I mean, you have to do at least 20, 30-year trials, but everyone's out here just trying to make money and put out the medicine as fast as possible. We don't even know what real effects that these medications will have in the distant future. You know what I mean?
Yeah. I mean, I think the U.S. actually gets criticism for putting things out too late. Like, I feel like the FDA, they do more research, and they're more cautious than like the European countries. A lot of European countries, they will put out medications that have been out for years, whereas that have shown that it'll help, but a lot of European nations, they are not as cautious as the U.S. is. So actually, I think the U.S. gets more criticism for being too slow in putting things out.
Mm. I mean, but we
Because
still
they require more research and more data and all this. But anything that you put out, any medication you put out, what they do is there's always like a FDA program, and like the pharmacy too. You can report symptoms. So then after a while, like there was a medication called varincicline. I forgot what the brand name is, and it was a medication that would help people quit smoking. It's called Chantix. Yeah, that's it. And but then people started saying that it was causing like suicidal ideation, and that it was causing some heart abnormalities. And so then they put a black box. So once too many people start reporting, hey, I'm getting this side effect, and the FDA will put like a black box warning, meaning, to make sure that the physicians don't prescribe that medication. If the patient's already having suicidal, ideologies already, then, or sometimes they'll take drugs completely off the market. Drugs that were used maybe 10 years ago, they're not being used anymore at all. So yeah, I mean, I don't think that it's done that fast. And I think too, it's just so hard. Even if you get a study that tells you, okay, this is good, it really, the best way to really trust a drug is if it's been, these older drugs that have been out forever and we have more experience. Because even if you study something really well and everything looks promising, when you put it out on the market and a lot of people start reporting like horrible side effects, everybody is different. Like, I mean, some people can die from taking, aspirin. They can die from taking ibuprofen. And ibuprofen is such an easy drug. I mean, I take ibuprofen all the time, but some people will get a horrible skin reaction and they can die from it. So different bodies work so differently, and it's very unpredictable. So the FDA actually gets criticism for putting things out too late here.
Well, that's crazy.
Yeah. Now, most people, I guess, they feel like the opposite.
Yeah, well, I just feel like a lot of people still, despite what you say, like they still feel distrust, and like these companies are just pouring out all this medicine, and it does seem like there's all these just different side effects that affect people. I mean, like there's this one heart medicine that my grandma was taking. It was for high blood pressure.
Metropolitan?
Yeah, but then it eventually causes heart failure, and that's what she, one of the side effects could be heart failure, and that's what she passed away from. So I'm just wondering, do some of these things, they act like they're helping us, but in the end, they kind of make us weaker?
I mean, it depends, because she had hypertension, so hypertension untreated will eventually give you heart failure. So it's kind of hard to know if her heart failure was from her blood pressure, or from years of blood pressure issues, or if it was from the medication itself. And definitely there are some medications that can lead to heart failure.
Yeah, but you don't think also people are being overprescribed, unnecessarily prescribed?
Yeah, no, for sure. I think because so I try to take off as many medications as I can, and I notice that a lot of doctors, a lot of patients will like you when you're the type of doctor who likes to take them away from medications, because I hate taking pills. So I'm like, I don't want them to be taking this unnecessary vitamin or this unnecessary medication. So and we are taught in training, polypharmacy, the minute you have all these medications in a person's body, they interact differently, or they're metabolized by the liver, and it can increase the concentration of this other medication. So really, you want your patients to be on as little drugs as possible. But yeah, I mean, sometimes we are overprescribing things, and a lot of times I overprescribe stuff, and people never pick it up from the pharmacy. If I tell somebody that they're diabetic, they always tell me, "Oh, I'm gonna diet and exercise." I'm like, "Are you sure? Like, are you sure?" Like, they'll be pre-diabetic, and they always say that they're gonna diet and exercise, and some of them do it, and they're great, but it takes so much discipline. Like, it takes so much discipline to like change your whole life around. Now that you hear, oh, you're pre-diabetic, people are like, yeah, I'm not going to get diabetic. And then I see them in a few months and then they're diabetic. Mm-hmm. So it's hard too, because I think we're a country, again, we're like unhealthy. There's so much bad food options out there. And I think too, when you have low income communities and the supermarket, isn't selling any fresh fruit, or the fresh fruit is super expensive there. That stuff is like planned out poverty, and you can't have like a healthy. There's just so many things that affect the healthcare of our patients that have nothing to do with medicine, and so much to do with how that community is structured, like mental health. Because if your patient's depressed because they're always worried, and it feels so sad as a doctor, as a healthcare provider. You can spend and make somebody feel good for the 1 hour that they're with you or less, and prescribe something to control their blood pressure to prevent them from having heart failure, but then they become depressed. They can't sleep because they can't pay their bills. Their kid got shot, with some gang. And then they're depressed, and then they don't want to take your pills. And then I have so many people who, they always tell me, Doctora, I can't take care of myself because I just don't care about myself. Like, I have so many things to worry about. I have to take care of my mom. They don't have money to put the mom in, in a nursing home, or have somebody come and help them take care of the mom. So it's just, there's so many societal issues that we can't help so many people out. It's not about a pill. It's not about, it's so much things that need to be fixed in society for us to really have, to have a healthy society. Yeah. Yeah. To be able to impact those lives that are already so ignored and marginalized. Like, it's going to take so much more than just having a doctor that speaks their same language. Medicine is so complex. Health is so complex. That's why so many people are so opinionated. Health is it's so important to us. Without health, nothing is right in our lives. And I feel like because of that, it's something that everybody is very passionate about. And that's why there's all these like scam doctors, these natural scam artists who prey on people who don't have access to the healthcare system, or who had a bad experience or something from it. Health is just so complex. It's so important. It's so many people are so passionate about it, and it's hard. There's so many issues in it. In such a broken society, it's hard. We have so much work to do.
Yeah, definitely.
I was also wondering, when a doctor prescribes medicine or whatever, do they get like some commission, a cut from the company, from the company making these drugs?
So that's like from the private world. So I've been training really only in like public hospitals. Mm-hmm. So I don't really, I'm not exposed to that world. Mm-hmm. But if it's a new medication that's like pharmacy put out, and it's a new medication, and they do get like like paid or something from it for prescribing like a newer medication. But like it's in our culture. So I guess the way that we're trained is to just stick to the medications that we've been already using, and that are that we're taught, hey, they have nerve pain from diabetes. Let's give them the cheaper one, the gabapentin. That's cheap and it works in most people instead of something newer. So we are taught that to try to be cost effective, even though we have such a freaking expensive healthcare, right? That's how we're trained. But yeah, they do get that cut from the newer ones, and that's so that more people start using that medication and all of that. I mean, big pharma has deep pockets, that's for sure.
Yeah. Well, Isis, we've been here for quite a while, and we don't want to go ahead and take too much of your time. We want to go ahead and thank you for having a conversation with us. One last question. Any last words you want to say to people aspiring to be a doctor or taking that route? Any more of advice or anything you would like to say to El Pasoans trying to become doctors?
It's something that you have to really think about, like what you want long term in your life. You're going to sacrifice a lot. Right. You're going to sacrifice a lot of your 20s. It is going to be hard. And I think that if this is something that you're passionate about, it's not just taking care of patients, because you can do that being any other healthcare professional. But if you're a type of person who really likes learning, reading all the time and learning more and more, you like the complexity, you like taking care of people, and you are willing to sacrifice, I would say do it, because I still feel very young. And I know that if I wasn't doing this, I'm like, I don't know what else I would have, been doing. So if you really like school and you don't watch all those medical shows, because I haven't watched any of those medical shows, but I just see like a little bit and I know that it's trash. It's not like that. It's not steamy. It's not sexy. There's so many days you're going to cry. You'll be on the struggle bus, but as Latinos, we have to do it. We have to be there for our community. We have to be the ones to sacrifice and get to a point so that more people of our background can be able to treat these patients and gain their trust and make medicine better. We need more of us. And I just recommend for you guys to, just be really thoughtful, really think about what you want from this life. And don't think about the obstacles, because there will always be obstacles in anything. And I think the thing that has gotten me most far in life is ignoring the obstacles. People will tell you that they're there, and they will always be there, but there's always ways around the obstacles. And just make sure that you are honest with yourself and what you want out of this life. And if you want something, then just go ahead and ignore every obstacle.
So if you could go back when you were a kid, knowing what you know now about medical school, you would still pick it again?
I don't know. I mean, sometimes I go back and forth. But I think, I don't know. I feel like more than anything, I think as humans, I think sometimes we have to be more grateful for what we have, because we always think, oh, when I have this and that, that's when I'll be able to be, happier and have more joy and this and that. And that's something that I feel like being in this field that's so like disciplined. There's so many times when instead of like going to dinner and going and having fun, I'm like, no, I'm going to stay in and study. I'm going to do. So it's sometimes overkill on the discipline, where you feel like you need to keep doing more and more and more, and then you're not really living life starts feeling like a checklist.
So it becomes an obsession in a way.
I don't know, I guess, or like just, it's like almost like guilt of feeling like I need to be doing this instead of, like yesterday I went to the pool at night and I was like, wow, like to be able to just be free and like not having to be worrying about I need to be studying this or I need to write that paper or do this research, blah, blah, blah. And I think sometimes I see friends who like didn't go to college and they have their little families and, they're just enjoying and living life and with their families. And to have gone through this career, like I had to live so many years without my family because they'll send you wherever. So I don't know. It's a hard question. On some days, I would tell you, yes, I would do this all over again. And then on my low days, I'm like, damn, like, why did I even study?
Right.
I could have been chilling. Like, I could have been working at Sephora selling makeup. Like, that would have been lit.
For sure, dude.
Yo, this is not what I should be saying. Young kids, go to school.
Yeah. Hey, sometimes
Young
life
kids,
gets
go to
real.
school.
What?
I mean,
Yeah, you could have asked me off of the podcast. You could have asked me this off the podcast.
but I think it's important for them to understand that's a lot of work and that you can't go into it with the mindset that you're just gonna get rich right away or something.
No, this is not the path. If you want to get rich, do everything but this, yo.
Hey, but things that take harder to achieve are actually the best when you finish them. When you actually accomplish your goal, you're like, God
For
damn.
sure.
You know what I mean? You're more proud of yourself.
Yeah, for sure. For sure.
You pushed yourself farther and you got to know your limits. But
For sure. For sure.
But Isis, like I said, thank you for having a conversation with us.
Thank you.
I'm sure this was a very informative podcast for people out there trying to see what's up with the whole medical school. Like I said, as El Pasoans, even though we have a medical school here, we don't really fucking believe that we could do shit like that. We don't think that we can accomplish these types of goals in our lives. But I figure if they see other people that look like us doing it, then they'll be like, oh, fuck yeah, if they're doing it, why can't I do this shit? You know what I mean? And
no, exactly. And that's the thing. People will always tell you, oh, you shouldn't because of this and that. But you got to realize, what do you want? Are you willing to sacrifice? If so, if yes and yes, then just ignore the obstacles because there will always be a way for you to get what you want in life. If you focus too much on the obstacles, you're spending so much time on focusing on what's not going to help you get there.
I think as humans, we lack to appreciate obstacles. I mean, I think obstacles is what makes life fun. It's like a movie, right? If you watch a fucking movie where there's no fucking problem, everyone's happy, you're like, what the fuck am I watching? I need some problems. I need some goddamn fucking obstacles.
No, that's so true. That's so true.
Right?
That's so true.
That's what makes the movie fun.
And that's what I think. I'm like, if I wouldn't have done this field and like been struggling, I would have been so bored and depressed from not having enough struggle.
Exactly.
Like, uno nunca sabe. That's why whatever you end up doing in life, you have to just be grateful and you just have to be grateful for what you have and be appreciative of the moment. But yeah, obstacles definitely keep you on your toes.
Hell yeah.
It's true. It's true.
Anything you want to say, my friend?
No, just thank you again, Isis, for the conversation. It was very like Louis said, it was very enlightening.
Yeah. And
you know what? Y'all should invite me. I would love to do a one-on-one with like the biggest conspiracy theorists. Just like go on, like just like get mad doing the podcast.
Hell yeah. Once we move up to better podcasting, we'll go ahead and have some people challenge each other and shit like that. That shit would be dope,
That would be kind of cool.
Yeah. For real. Okay, well, thank you so much for having me on the show.
Well, thank you, Isis, and can't wait to have John and you in town so we could go ahead and chill and catch up.
I know. I'm thinking October, so I'll hit you up.
Hopefully.
All right, sounds good.
All right.
All
Well,
right, cuídate mucho.
you too, and have a good one. Thank you, Isis.
All right, y'all take care.
You too.